Hi everyone, and welcome to this session around quality assurance. So we're going to look at the 5 key questions in which is asked around internal quality assurance. And this is obviously around the CQC fundamental standards, the CLOEs, and it's what underpins kind of contract requirements, whether that's through NHS or through local social services. So ideally, when you're running an audit system, it's really difficult to have several masters. What I mean by that is you'll do audits for CQC, you'll do audits for the health and safety executive, you'll do audits for environmental health, for the fire regulations, for local authorities, etc., etc. So it just becomes a bit overwhelming. And what you really need to do is create a quality audit system that encompasses all of that. And really, that's what CQC tries to do with their CLOEs, the effective, safe, and well-led. And ultimately, everything is just an extension beyond that. So if you apply the same CLOEs to environmental health or to health and safety or to your audit frameworks, then you're not going to be far from where you need to be around providing an outstanding service. Now, my top tip, which really isn't my top tip, it's just common sense, is always aim for outstanding. So if you then fall short, you're still hitting good. If you aim for good and you fall short, you've got nowhere to go. So just bear that in mind. So you can see the 5 key questions. So as we go through the single inspection framework, as we look at quality audits, I just want you to hold in mind, is your service safe? So are the people protected from abuse and harm? So again, you can think of environmental health, can't you? Food safety standards, you can think of health and safety, slips, trips and falls, you can think of fire regulations, all of that's safe. You can think of your safeguarding, your whistleblowing. Is it effective? So that's how you network. That's how you write your care plans. That's how we know we're achieving what we're achieving. So what do good outcomes look like? So again, are you picking things up quickly? Are you doing things like vital signs? Are you monitoring deterioration of health? Are you getting those care plans in quickly to provide effective care? Ultimately, are you caring? So are your staff trained to be kind, caring, compassionate? Does it meet that dignity, privacy, and respect piece? Are you responsive? So, in other words, do you listen to the people that you look after? Are you responding to the service user needs, the voice of the families, the voice of the staff? And overall, are you well led? So, are you an inclusive leader? Are you able to adapt your styles? Are you able to audit yourself? Are you able to come up with your own quality improvement plan? And these are the things that we're looking for under well led. So we've run through the CLOEs, and I know you all know what CLOEs are, but equally, a lot of this safe, effective, caring, responsive, and well led comes around knowing your notifications. So, for example, if you have a death notification, have you done your audit on that? Are you reviewing your deaths? Do you report them timely? Do you learn lessons from them? Do you look at multiple ways of learning and networking? Those kind of things. Good. So I'm not going to go too much into the 5 key questions on CQC because what I want to do is just first of all show you the audit tools in which you can use. Now, multiple platforms have different audit tools. If you have your own audit tools, that's great. Use them if they're built in. If you haven't, just see if they do the same. And sometimes what you find with audit tools, some can be quite restrictive, whereas the manager, you want that overview. You want to be able to look holistically across an organization to make sure it is effective, safe, and well led. So you can log in to the United Care Networks. Once you've logged in, you should then be able to go down to the bottom and look at quality assurance. And along quality assurance, I give you some audit tools, internal and external. We talk about CPD accreditation, what that looks like. And then there's some other pieces around dementia friends and obviously your train the trainer. So firstly, external frameworks are great because they give you the over and above resources that you need to run your service. So, for example, the things like Dementia Friends, it's a great piece of training, it's a great resource set. So you're now going over and above and being responsive and safe and effective because you're upskilling your staff. Equally, there's frameworks around the LGBT plus Q. So again, looking at safe, effective, well-led and responsive, etc. So just look at audit tools to begin with. We'll start at the top and work our way through this because you've got access to this as one of my students. So here, for you to be this holistic manager, you need to have insight. You need to have governance over all of your domain, over the whole business. And what does that mean? Well, that means you've got to do a quality assurance planner for the year to show us that you're continually monitoring quality. And then from that quality improvement plan, you're then going to create a self-assessment report. So you're going to do your audits, you're going to learn from those audits. And ultimately, you can see on here, there's a lot of areas to consider. So when we think about the people that work in the organisation, we've got the nominated individual, the registered managers and staff. So in here, you've got some induction workbooks that show that you've put a member of staff through their paces and they've understood all the things around working within social care. You've then got your business continuity or contingency planning. Now, around this, there are ISO 9001 standards that can go alongside business continuity planning if you want a lot more detail. However, in here, I've given you some example plans, and those plans are things such as what you do with large sickness, flu, pandemics, weather, etc. What happens if your business catches on fire or there's a flood? What do you do if your IT services go down? So that's your business continuity. Okay. We've then got our single assessment framework. So that's the new CQC requirements. So in there, there's some tools to help you prepare and plan. Looking at the inspection, so this is your mock, so you should be running through this, and this is going to be your tasks. What I want you to do is run a mock inspection within your service, and I want you to feed that back to me. So this is where I want you to be for the first task. And then obviously you've got the rest of the month to kind of work through the other areas. When we think about complaints and we think about well-led and responsive, does the service user have a voice? Are we listening to that voice? How many complaints are we having? Because complaints are an excellent tool for lessons learning and making sure that we're being consistent and people feel empowered to report. When we think about safe, when we think about effective, when we think about responsive, we need consent. And consent is not an easy thing. It's fluid. It's dependent on illness. It's dependent upon a lot of situations. So there's some audit tools there to make sure that you understand what consent is and how you get those. When we talk about safe, we think about dignity and respect. When we think about well-led, we think about caring. All of that comes under dignity and respect. So that looks at your dignity and respect processes there. We're then going to think about the duty of candor or candor. And duty of candor means being open, honest, and transparent. So open and honest means we're learning from mistakes, and transparency means we're doing lessons learned and we're reflecting and we're recording and reporting. Up here is your planner for the year. So again, you can click on there, pop your planner in your office, and then you can follow all of this because there's no way you can do this all in one go. It's a bit like how do you eat an elephant, and it's those bite-sized chunks. Just making sure you do little bits of those. We've got good governance. So what does good governance look like? So that's what this topic is about. So this topic is about internal quality assurance and good governance. You have your staff well-being. So think about your staff, think about well-led. That's all around there, staffing. We've got about reporting abuse. So that's your safeguarding. Premises and equipment, again, safe. So that's your hoists, your machinery, your PAT testing, your sling testing, all of those stuff. You've got your medication audits and toolkits there. The inspection toolkits, so again, you can use that in line with this one up here to help you prepare for an audit. So let's say you've been given notification, you need to go through those to make sure that you're doing everything you should be doing. Food and drink. So again, if you provide food and drink, again, think about effective, safe and well-led. Are you meeting environmental health standards? Think about allergens, think about choice, think about dignity. It's such a big topic. We're then going to look at those internal audit tools, so things that you can do there. We've got your whistleblowing, and again, linking up to complaints there. We've got safety and what safe looks like. We're looking at recruitment and retention, so that recruitment process. So again, a lot of home managers fall down on recruitment and retention because, again, it's such a massive piece of work to ensure that you're inclusive, that the job ads aren't discriminating, that you're following legal processes. And equally, you're making sure that you've got all that recruitment and training and all of those policies in place there. We then look at about person-centered care planning. So again, a couple of months ago, we did care planning, and you can now see how big care planning is in the big picture. It's just one of those wheels in a massive machine. Thinking about activities, so if you're in a day centre or a community centre, great, meaningful activities. But if you work in home care, when we're leaving individuals on their own, are we leaving them with some meaningful activities? Thinking about your infection prevention toolkits, so looking at hygiene and personal spread of infections, etc. And then fit and proper staff, which links to recruitment and retention. So again, you can see here, when we talk about auditing, it is a huge topic, and something that you're going to have to start getting on board relatively quickly. So if we look at then a CQC inspection, so if you click on these, it will take you to some paperwork here, and it'll look at an inspection checklist, gaps, what to do gaps in your inspection checklist, looking at how you can improve. So you're going to do your audit. How do you then improve that? So that's that quality improvement plan, the QIP, quality improvement plan. You're going to look at key questions through the checklist. Is good enough? So we call it the mum test. So would you want this service to be looking after your mum? Key lines of inquiry. So that's the effective, safe, well-led and responsive. And then monitoring your safe Chloe. So again, there's a lot on here. So we just look at the first one, and again here, you can see alongside your audit planner, you would then ask these questions. So you put your name in there, the date there, and this is just, you can see an observation here. So do your staff treat service users, staff and their managers with dignity and respect? Yes or no? If it's yes, great. If it's no, okay. What are we going to do about that? How can we improve that? So we're going to go through those observations there. We're then going to do a review of records. So again, this is just a helicopter snip into the service. So are staff training records up to date? Are there a range of policies and procedures in place? Now, again, I've taught you how to write policies and procedures, so I know that you now know what you're looking for in policies and procedures. Our care plans and risk assessments up to date. So again, you can see why we've now left the audits till the last part. So you now know what an individual care plan should look like. You now know what a movement and handling risk assessment should look like. You now know what risk assessments around behaviour plans should look like. Can you demonstrate to me things around accident reporting, complaints and safeguarding? So these are the things that you are going to ask yourself. And remember, this is about you being honest to yourself, because you can't improve your service if you're not honest. You know, if you're sitting there going, oh yeah, we do it all, great, but what's the evidence? What am I going to see as the inspector? Talking to your staff. So when you think about your staff, ask them some questions. So do the staff say that it's well led? So ask the staff, you know, what do they give your management team? Are you confident around your whistleblowing? Are you confident that your organisation is open and transparent? Do you learn from lessons learned, etc.? And then finally, talking to your service users. So how are you recording the data from your service users? Are you doing phone calls? Are there surveys going out? And how are you collecting that? So from the above, if you've written no, that's classed as a non-conformance. So very much like your ISO standards, if we're not doing something, what is it we're not doing? And then what are you going to do? What are the corrective measures that you're going to put in place to correct those? And then you're going to pop a review date in there based on the urgency of what you've picked up. So what we need to think about here is if then an inspector came in and you haven't done all these things, we're not going to hide it because that's not what open and transparent is. What's important is that you can say to the inspector, look, through my audit process, I have found areas of non-conformance. Here they are, but this is what we've done about it. We're going to put this in place and this in place and this in place. So that's what shows well-led. That's what shows responsiveness. Because again, nobody's perfect. CQC understands that. But what they want to see is the fact that you're able to assess risk and that you know what corrective measures to put in place. So then as we go through things, we may find some gaps. And again, here you've got gaps between inspections. And here, this is from your last inspection to now. And really, the inspector can go back to the last inspection point. So just thinking about how long it is. Now, when you get rated, it triggers the next kind of when you're going to be seen again. So again, you can see here, if you get outstanding, you've got 30 months roughly from when they're going to see you again. And again, if you require improvements, 12 months, if it's inadequate, 6 months. So you can use that as a similar tool for you to be thinking about how you're going to monitor your own service. So if you've done an audit, you can grade yourself inadequate, requires improvements, good or outstanding. And in that way, you can set yourself timeframes on when jobs need to be done by. And let's not be unrealistic. We know the change cycle takes roughly 6 months. If we look at improving your CQC rating, so this is then a self-assessment based upon what's already there. You can go through this, looking at then a way of improving that CQC rating, and you can use this audit tool to do that. So again, if you haven't received an outstanding rating, which not many people do, they generally get good or requires improvements. Here, you can think about other things that's going to push that rating up. Remember, good is you're doing what's required of you. Outstanding is you're going over and above what's required of you. So what I tend to hear is, oh, but the other service doesn't do that. Well, is the other service outstanding? And if the answer is no, then they're not doing anything over and above what they should be doing. If they are outstanding, then that may be why they're doing what they're doing. But again, here you can see, are your staff trained in all aspects of care, including preventing abuse, managing risk, protecting people's rights, enabling choice? Do you use a holistic approach? So again, you've got those audit tools there to go through about kind of really pushing those ratings up. Inspections or key questions to ask during kind of when you're doing your mock audits. And then these are particularly around the Chloe's. So here you can see under safe, do your systems protect people from abuse? So if you're having lots of safeguards, if you've had section 42s, can you put a yes to that? Unless it's you raising them. If you're raising those safeguarding concerns, then the answer is yes. If they're being raised against you, the answer is probably no. So do you assess those risks to safety? Do you have enough staff to keep service users safe? Do you give medication safely? Do you prevent control of infections adequately? And do you learn from those mistakes? So again, if you've written yes, great. If you've written no, then down at the bottom, you've got your non-conformance reporting. So again, another holistic tool, big picture, just to drive through that quality improvement cycle. When we think about is care good enough, and is it good enough for my mum? We tend to say, oh, would I let my dog in here if you haven't got a mum? Here you go. So this is the good enough mum check. So if you can go through those and you can say, yes, great, you're running a good service. If you say no, then you've got audit reports to do. You've got things to learn from. But again, these would be great questions to ask staff because they're the ones actually in the front line. When we think about those key lines of inquiries for activities around those checklists, so again here, looking at those effective and responsive areas, you've got here some descriptors and then things that look good to meet those outcomes. So again, you can use these key lines of inquiry. So again, similar thing, yes, no. So that's there. And then obviously monitoring safe to finish off those Chloe's you've got here. So it looks a lot of paperwork, but actually a lot of this is just ticking and making you think holistically about your service. And if you can mark yes, then you're on the right tracks. And if you mark no, then you've got a problem. And when we think about the outcomes of these are what inspectors are going to be asking you as well. So contract requirements, exactly the same thing. So once you're in there, you've obviously got a link to this drive. You can see all of those. If we look at the Single Inspection Framework, which is obviously the new quality assurance processing, you can see here we've got quality statements, we've got single assessment frameworks, and we've got what the single assessment framework is. So here you can go through this and have a read of what the single inspection framework is. So that's just your guide to understanding the single inspection framework. And then here we'll have a quick look at this paperwork. It's bought the same. Let's get rid of some of this. So again, just more reading materials for you there. Let's have a look at. Okay, so there's your medication examples for when you do an audit on medication. So again, just some processes there. This is your new flow chart for the CQC regulatory requirements. Again, you can, I have to give you the, oh, this one doesn't work. I think you have to download that one in Word. This is your gap analysis. So again, here, this is quite a useful tool to do straight away. So this would create your self-assessment report, your SAR, because it's quite a lengthy document by the time you've completed this. And you can see here, you've got your safe, effective, and well-led. Your Chloe's going down the left-hand side. You've got kind of feedback from the people experiencing the service, feedback from the staff and leaders, feedback from partners, observations on and off, and then the processes and outcomes. So again, here you've got the question here, is there a safe learning culture? And again, you would just fill that in. And as you fill that in, it creates the foundations of your quality improvement plan. And each year you do your declarations back to CQCs. It's like a self-audit that you do. So that's a great audit tool to run through the big picture of the organisation holistically. These are your quality statements for evidence. So again, just looking at that, what we've just looked at here, it talks about examples of evidence. So people experience in the care service. So you can use satisfaction surveys, letters, suggestions. So it's just how you're meeting those and what it is you're doing to meet those outcomes. Looking then at robust evidence. So again, when we think about evidence and we think about, okay, well, we've done a survey, well, just think about how safe was that survey? You know, who completed it? Is it a good, reliable source of evidence? So if you've done, you know, let's say you've done a survey, you've asked 100 people, 100 people said your survey is amazing, it's unlikely that that's valid. You know, is it valid, authentic, reliable, current, and sufficient? So thinking about your evidence that you're collecting, where does that come from? Is it a good source of evidence? And again, your single assessment framework quality statements are there. So again, when you've got these words, so when it says a learning culture, so this is like a glossary, it says we have a proactive and positive culture for safety-based and openness and honesty. So when we think about a learning culture, you could be saying, well, we do online learning, we do face-to-face learning, we do micro-learning, we have people coming in, we do skills-based learning. So we do all of that stuff there. So there's lots of things there for you to run through to help you conduct your own audit. Here you've got your planning and scheduling. So this is, if you read this, it's kind of how you're going to run through your own audit there. There's some links there to the website. So here you can see your own self-audit report. That's under Single Inspection Frameworks, audit tools. The gap analysis, which you've already just seen. There you go. So we've already seen those. And then the Single Inspection Framework there, quality statements that you've already looked at. So go through your audit tools, have a look at them, have a look at how you're going to run your internal audits as an organization. Think about your quality planner. So here I've given you a template for your quality planner. And in here, you can see you've got different checklists around different tools. So again, just have a look at those and click in. Just so you're familiar with the terms, and we talk about an open culture and transparency. What does that look like? And again, improving your service, really. When we look at things around shared values, if we talk about values, goals, and mission statements, that should all be in our statement of purpose. So again, we need to go back to our statement of purpose just to make sure that that's all where it needs to be. So have a look, dig around, but what I would like from you all is for you to conduct your own mini CQC inspection. So for that, you need to go into your CQC inspection. You're going to need to go to, you can use all of this paperwork if you like, but what I would want to see is oh, actually, I don't think it is that one. Where was that? Single Inspection Framework tool. That was it. Single Inspection Framework tool. And the ones that I want you to do, first of all, is your gap analysis. So go in, Single Inspection Framework tool, gap analysis. If you complete that, that would be a great start for us to have a look to see how you're getting on. And then from that, you can then use, so for example, let's say under safe, you can go, yes, I'm running a safe service, and I'm going to go, why? Where's your evidence? And you can go, well, look, under safety, I've got basic care safety tools and safety audit tools. I'm doing all of this. So that's what safe is. Safe is, have I done accident reporting? Have I got emergency procedures in place? Have I dealt with falls preventions? Are there fire risk assessments in place? Are people hand washing properly? Have we checked for hazards? Have we got infection control down? Are we moving and handling properly? Have we got the right risk assessments in place? So that's what safe looks like in care. And then obviously around the environment, that's all your environmental stuff. So electricals, working at building, hazardous substances, PPE, etc. Okay, so you can then say, yes, I'm safe because I've completed all of these areas. Again, you may then go around safeguarding. So it looks at safeguarding here. It says, let's have a look at safeguarding. So you might go, well, I know we're good at safeguarding because my safeguarding audit toolkit, which is here, says I am. So I've got my service user checklist. I've got my service users free from abuse. I've got my policies and procedures. So if we look at a safeguarding checklist, There you go. So that's your safeguarding checklist. Do you have a policy? Do you know how to write those? Do the staff know how to identify it? Do the staff know how to report it? Have you got a complaints procedure? Have you got control in managing hazardous behaviour in place? What is your staff recruitment process? What does external staff look like into the business? So that would be how you mark for safeguarding. So again, you need to run through these toolkits to make sure that you can mark, yes, I'm safe under safeguarding. Because again, when you mark yes, my next question to you will be, demonstrate it. What evidence have you got? So in here, if you think about what it said under, it gave you the examples. So if we go back to Single Inspection Framework, and we look at the quality statements, it will tell you roughly what we're looking for. So there, again, safeguarding, can you see? So again, we think about medication, and you write, well, yeah, we're safe with medication. Good. Where's your medication toolkit? Show me your last audit for medication. Oh, so again, you can show me, you'll go in and you'll say, right, medication toolkit. So we'll go back there, we'll go medication toolkit is here. There you go. So there's your medication toolkits. So hopefully you can see by going through this, it's going to force you to do the audits. It's going to force you to pick up the forms. It's going to force you to go through everything. So infection control, you've got an infection control audit tool. Medication, you've got a medication audit tool. Assessing needs, you've got a care planning tool, an evidence-based. So as you go through this, you'll see the audit tool that helps complete it. Okay, are your staff kind and caring? You've got the dignity and respect tool. So are you promoting choice? You've got the choice audit tool. So hopefully you can see that what we're saying here is so again, if we look at choice and consent, there we go. So here's your consent checklist. So does consent look like this? So when we say we give consent, that's what we're asking. Okay, so hopefully that all makes sense. So if there are any problems, please WhatsApp me, but that gives you an idea, just a basic idea, so of how you can run your own internal audit, and off the back of your own internal audit, you create your own quality improvement plan. So from this audit, if you've written no, what are you going to do about it? And remember, it needs to be for every single service user. So if you've got 100 service users, then 100 service users you need to say yes to all 100. Because again, if I came in as CQC, I may just randomly pick patients 1 to 5. You may have 4 out the 5 all done, but that one that isn't, then it's not safe effective. And then again, when we think about what the council are looking for, they're looking for consistency across all. So if they come in and they pick up 5 patients' files, 4 are right and 1's not, then you're going to fail that audit. So just so you're aware, you're then going to go in, you're going to have a look at the website. In here, you're going to go to Network Portal, you'll bring up your audit tools. You're going to go down to Single Inspection Framework. You're going to start your Single Inspection Framework. You're going to start your audits. So each of you need to do this in your own area of responsibility. So we need them for the service in which you're working with. Once you've done that, remember this is going to be highly sensitive once you've filled it in. So then please just send me this. You can do it securely. You can do it through a WeTransfer if you want to WeTransfer it to me, or just do it through just send me a link so you know that I can see it and it's not going anywhere. Because obviously, once you filled this in, you're identifying strengths and weaknesses within your organization. Brilliant. Well, that's everything for now. Hopefully that all makes sense. Any questions, you know where I am. Please feel free to WhatsApp me. But remember, good governance is about you being honest. It's about you having the ability to look into your service and assess your service effectively and honestly. Brilliant. Take care for now, and I will see you all shortly.